March is National Kidney Month, an important month to spread awareness of kidney disease. To start off, I'll have each of our important guests here today introduce themselves.
Good afternoon. My name is Dr. Heyse. I'm a kidney specialist with Nephrology Associates of Dayton, and I've been in the area for about 14 years taking care of kidney patients.
And Karen?
I'm Karen Hagaman, and I am a kidney patient.
And Dr. Heyse?
Yeah, I'm Dr. Heyse. I'm a board-certified general surgeon. I've been in practice in Dayton for the past 8 years. One of the mainstays of my practice is creating dialysis access for our kidney patients.
All right. Well, thank you also for being with us. I guess the first question I want to ask is, why is it so important to spread awareness of kidney disease?
It is important because there are quite a number of patients with kidney problems in the country. And the concern with kidney disease is people lose their kidneys and require dialysis. And the goal is to make awareness of this disease so that we can prevent progression to dialysis and keep people longer and healthier with their own natural kidneys.
Okay, and Dr. Heyse, can you explain what dialysis is?
So dialysis is basically a way for a machine or some other means, if you will, to do the job of somebody's failing kidneys.
Okay, and I guess a question for the doctor is, what is this procedure like? Can you tell us a little bit more about it?
So dialysis, of course, is a procedure of replacing your kidney function using artificial means. There are two kinds. There's blood kind of dialysis, where we use a machine to clean your blood, to filter your blood, as opposed to the second kind called peritoneal dialysis, where we use other techniques to use your abdomen as a cleaning, I'd say a cleaning machine of sorts, to clean the blood and to preserve life.
Wow. Crazy. It's incredible. And Karen, you've been through it. Can you tell us a little bit more about your experience?
Yes, I've been in center with hemodialysis, and I've had peritoneal dialysis, and I'm now doing home hemodialysis. My husband and I do it.
And what is it like for you?
Home hemo is much better for me, simply because I was so tired with the other, and it takes a lot out of you. The in-center dialysis is rougher on your body. The PD dialysis is a good dialysis method, but I had trouble. My body kind of wouldn't go along with it. And so I'm doing the home hemo, and it's much better. I feel better. I look better. I'm much better off with it.
How do you recognize when you're having issues with your kidneys? Karen, how'd you know?
Well, I found out that I was in like stage 3 kidney failure, and I went to Dr. Heyse, and I tried for a couple of years to maintain a low sodium diet and try to keep off dialysis. And then all of a sudden my kidneys just totally failed. And last January I ended up in the hospital and ended up on dialysis.
I can't even imagine. So what would you advise, I guess, to either one of the doctors here, if somebody is experiencing issues like that? Where should they go? What should they do?
So the first thing, of course, is to stay on top of your health and make sure you have regular checkups. Blood pressure and diabetes are the two main reasons why people end up on dialysis in this country. And taking care of those two things will preserve your kidneys. And so when there is a problem with the kidneys, then a primary care physician then refers you to a specialist like myself, who now takes care of you. And when indeed a need is for dialysis, then we work very closely with surgeons like Dr. Heyse to form a team that takes care of your total needs on dialysis.
Well, unfortunately, we're out of time, but I thank all three of you so much for coming on and telling us all about this.
Thank you.
Thank you for having us.